Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to the 19th episode of Seeing Clearly, which is a pre-clerkship guide to all things ophthalmology. Today we are very excited as we have two guests, and our two guests are Dr. Carter Lim and Dr. Mahadev Bhalla.
So I'll first go ahead and introduce Dr. Mahadev Bhalla. So Dr. Bhalla is a second-year ophthalmology resident at the University of British Columbia. He initially completed his bachelor's degree in life sciences at Queen's University. He then returned home to BC to complete his medical degree at UBC. His past research has been in medical imaging and topics including glaucoma, retinal pathologies, and prior to that, in Alzheimer's disease and dementia. He has been involved in his community by being an active blood donor and organizing blood drives, as well as creating a South Asian health club in his first years of medical school to conduct blood pressure clinics at Sikh temples. His other interests include exploring new restaurants, spending time in the mountains, either hiking or skiing, and playing racket sports.
And now just a little bit about Dr. Carter Lim. So Carter is a third-year ophthalmology resident physician at the University of British Columbia. He completed his undergraduate degree at Western University and medical school at the University of Ottawa. He is a previous scholar of the Eye Foundations of Canada and has a passion for mentorship and teaching. His past projects include research in glaucoma and cataract surgery, and he's currently expanding his interest into the area of OCTA imaging. Outside of work, Carter enjoys spending time with his friends and family. He plays some sports, he is a hobbyist photographer, and he is a supporter of what he describes as the best football club in the world, Liverpool.
The best football club in the world.
What he describes as the best.
Oh man, thank you so much for having us. It's a pleasure to be here.
Thank you so much for both of you for joining. I know both your schedules are quite busy, so we're really excited to have you here. I guess we can just jump right into the first question, which is, could you guys talk a little bit about your journey to ophthalmology? Carter, maybe we'll start with you.
Sure. Yeah, I can start off. My journey kind of starts off I guess I was introduced to ophthalmology pretty at a young age because my father has pathologic myopia and has some sequelae from that and has been followed by a retinal specialist since he was about 5 years old. And so I remember when I was a kid going to the ophthalmologist appointments with him and the impact that his physicians had on his life and his quality of life was really meaningful to me. And so that's kind of was my first intro to ophthalmology. And then during my undergraduate degree, I was lucky enough to do a thesis project with an ophthalmologist at Western University, Dr. Cindy Hutnick, in the area of glaucoma. And then so kind of before medical school, I had this interest in ophthalmology. And then when I went into med school, I was really trying to, explore all the other areas of medicine. And really, I really liked everything, but it was ophthalmology that still kept sort of inspiring me. And that's why I ended up pursuing this as a career.
Super cool to see the longevity of it. I feel like most of the interviews we do, we hear that it's kind of people stumble upon ophthalmology. So maybe we'll turn to Mahadev now and see if your story was any different. Probably.
Yeah, no, absolutely. One was a bit different, but similar at the same time. I was, as I mentioned before, I was doing medical imaging research, mostly in a computer lab. So I was doing quite tedious segmentations of the brain in an Alzheimer's project. And then this opportunity came up to help out at the eye care center. And at that point, to be honest, I really didn't know what ophthalmology was. All I knew was that I was tired of sitting behind a computer doing segmentations, and I wanted to go back to my passion, which is to meet people, see people, and interact with them. And so this project basically involved taking images of the eye at the eye care center, and in that process, I ended up meeting so many wonderful people, both medical, which is the ophthalmology team, as well as non-medical, in the sense that they were the biomedical engineers. And so just that entire interaction was such a wonderful experience for me that it really made a big impact. And that was my introduction to ophthalmology. And then when I went through medical school, I kept in touch with the lab and kept helping out. And I actually ended up exploring other avenues as well. So I ended up doing a lot of shadowing. And each time I really felt that I just didn't get that same feeling that I had when I was at the eye care center. And once I started getting more and more involved and meeting patients and meeting people and seeing them with their eye pathologies and just speaking with them, I kind of really realized that this is something I really, really enjoy doing. And so for me, I just kind of stuck onto it, and the rest was history.
That's awesome. It's nice because the both of you have definitely different stories, but you both, had this patient interaction, see how amazing ophthalmologists can be and the effect that they have on patient care, and then ended up in the specialty together, which is awesome. And
Totally.
so now,
Totally. And sorry, I don't mean to interject there, but I just feel like, I don't know if it's similar for you, Emaan or Danielle, but ophthalmology is pretty niche, and it's a little bit hard to kind of discover it in medical school, because at least in Ottawa, we had 1 week in pre-clerkship and 1 week in clerkship. And I feel like most of the people that I've met have stories of some extracurricular experience that kind of guided them towards this. And so, yeah, I feel like ophthalmology is a bit unique to that.
yeah, 100%. Especially honestly, that's why we started doing so much work with iCurriculum, because it was so hard for students to just stumble upon ophthalmology with such limited pre-clerkship exposure and even clerkship exposure. So yeah, thank you both for sharing that. Now, this switching gears a little bit, but still in the realm of ophthalmology. So we're so lucky that you guys are both residents at the University of British Columbia. So I was wondering if you could talk a little bit about your experiences. So I guess, Mahadev, we can start with you as being a PGY2.
Yeah, absolutely. My experience up till now has been absolutely fantastic. I just came off my first rotation at St. Paul's Hospital, where I was the resident in charge of the day pager, as well as doing call shifts in the evenings on top of that. And I have to admit, it's been a fantastic rotation. It was a mix of subspecialty clinics that I could get involved in, as well as kind of seeing all of the patients that are coming to emerge. On top of that, I also had clinics where I would be able to join for laser procedures, and specifically set out times for the OR. And so I was able to go to the OR quite a few times and get involved there. So it was absolutely one of my favorite rotations up till now, and really kind of set in that feeling that, this is where I want to be. This is exactly what I want to do. And all my patients that I saw were all seen by staff. And I think just that support was fantastic. But I do have to mention that I think one of the best parts about UBC that made this early start fantastic, or really smooth, I would say, it was the ability to come and join the group as a PGY1 for 8 weeks prior to toric. And in those 8 weeks, ironically enough, or funny enough, I was actually with Carter as my senior resident when he was a PGY2 at VGH, and with Miriam, Dr. Slamy, who was the senior resident. And so being the junior resident, I was able to slowly get introduced to kind of the logistics, how everything goes, how to answer call pages, and even getting the pager by myself for 1 week and then kind of off of it, doing evening call shifts with a lot of support and weekend call shifts. That all basically came together to help me when I came back after toric to start my PGY2 by myself at St. Paul's. I felt really, really comfortable and really felt quite able to interact directly with not only our staff members, but other hospital members as well when they would call our service.
Yeah, that's awesome, especially because, I feel like I can speak personally, the transition you feel like from pre-clerkship to clerkship is steep, but then obviously there's this other transition of transitioning as being a clerk and then going into residency. So that's brilliant. Yeah. And what about you, Carter?
Yeah, Mahadev spoke really eloquently about the PGY2 year. I think that as a PGY3, I've kind of just come over that hump, and reflecting back, I do think that PGY2 is probably the steepest learning curve that I've experienced so far in my career. And Mahadev is a little bit maybe too humble to say, but I think he's brilliant, and he's handling the extra learning curve really, really well, because it is challenging. Your ophthalmology is very physical exam dependent, and there's a lot of technical skills with being able to do a good thorough peripheral retinal exam, a good neuro-ophthalmology exam, for example. And when you're kind of thrown into the deep end, it can be a little bit daunting and challenging to kind of take on these challenges. But I think that for me personally, I think closer to maybe Christmas break, 6 months in to PGY2 is when I started to feel a little bit more comfortable and have a little bit more confidence in my skills. And then I think, looking ahead into my PGY3, there's so much to learn, but I think that the learning gets more and more exciting and fun as you go. And so, like Mahadev was saying, our PGY2 year is mostly emergency medicine. for the most part. There's a little bit of retina, a little bit of neuro-ophthalmology, and a little bit of plastics, which is great supplementation for, I think, the emergency clinics. But it isn't until PGY3 where we start to dabble in some of the other subspecialties. So I've just come off my glaucoma rotation, which was great. And now I'm starting pediatrics. So my first day actually was at the BC Children's Eye Clinic was today, and it's a whole new world there. It's it's a little bit also intimidating, managing the care for all these little kids, but they're all super cute, and it's really fun sort of new challenge. So yeah.
Thank you both for sharing your perspectives on it. I think what was most awesome about both your answers is the support that I saw between the two of you. It seems like you guys have worked together, obviously, and seems like you have a really good cohort to support each other, which is always nice, especially even between the years. So I was wondering if we could backtrack a little bit and look before you guys both started residency and to talk about your experience applying to residency. So Carter, maybe if you could talk about pre-COVID, and then Mahadev maybe during COVID, and any advice you have for our listeners who will be applying soon.
Sure. Yeah. So like you said, I was, I guess, the last group to do sort of in-person CARMS electives, in-person CARMS. And, I personally, it was stressful because you're kind of, have to be on edge for, months and months on end, but it was also a really fun experience traveling to all these different parts in Canada, learning from all these different people, meeting the residents. And so just speaking on the elective part specifically, I think that it was really nice so I did my electives at Ottawa, at Western, Toronto, and Halifax. And it was a really great experience seeing how, first of all, other centers did things, and getting to know the residents and the different staff, but also exploring the cities. I think that it was really nice in the sense that, committing to a residency for 5 years at least is a pretty sort of large sort of commitment. And it was nice to at least have some idea of what certain cities were like to live in. And so, for example, when I went to Halifax, it was my first time on the East Coast, and the residents showed me all these different places to check out. And I also went in September, which is like peak patio season, which was great too. And so, speaking on that, it's hard to get that sense without actually being there. So that's what I really liked about that. And then the in-person interviews were also great in the sense that, for the first time, at least in my experience, because, when you're applying to ophthalmology, there's not that many people around you that are applying to ophthalmology, maybe in each group. In Ottawa, for example, Emaan, there's probably maybe 4 to 6 or something like that. Queens, there's probably even less. UBC has more, but there's also more people. So I think as a ratio, it's probably pretty similar. And so when you're going through clerkship and, your third year electives, fourth year electives, there's not a whole lot of people around you that are kind of, interested or inspired by the same things that you are. And so when you do finally go to your interviews in person, here you are with, 20 other people that are all sort of super passionate about the things that you're interested in. These are people that might be your co-residents that you might spend every waking moment with, for the next 5 years. So there's a bit of excitement in that, and going to the different socials and meeting different people. So that was a really great part about it. But, it's also, quite tiring. I think I was in maybe 10 different cities in, a span of 2 weeks. And it wasn't very nice on the budget or the line of credit. But it was a really good experience, I would say. So in terms of advice, I think that getting to know the residents is I found to be a really helpful thing, because I think that they were able to shed a lot of light in terms of the culture of the program, what things they like, what things they don't like about the program. And they also might be your seniors down the road. So it's kind of nice to get to know, who they are and become friends with them. So if the med students have an opportunity to get to know the residents, whether it's on elective and being on call with them, I thought that was a really fun experience. And I really enjoy having med students with me when I'm on call and stuff. So
that's awesome. And I mean, the MD 2024 cohort will hopefully have an experience similar to Carter, but maybe for my cohort, the MD 23s, maybe we'll turn to Mahadev to tell us what we can expect and some advice that you have for that.
Yeah, absolutely. No, I will say that I think just like anything else in life, there's pros and cons to everything. And so, some of the cons that definitely I really felt like I experienced in regards to the COVID year was that I wasn't able to really show who I was kind of off the paper application. And so that kind of opportunity only presented to me during the interview process. And that's where I feel like I'm really able to shine. So I think in some instances, I really felt like I wasn't able to do that or even get an idea what the programs are like. And I think that was a big aspect of, me recognizing what UBC is like. I've spent medical school here. I've done all my 8 weeks of electives here. So I had a very, very good understanding of what the program was like in and out. And I knew the resident group was absolutely fantastic, like very, very supportive. And I heard, funny enough, I'd heard even great things about Carter from some of my other friends in my class that I worked with him. And so I know that was a big aspect of it too. But there are, some pros as well. And, again, kind of funny stuff in the sense that like you're able to do a lot more interviews at the same time. I remember doing multiple interviews in the same day, which would not be possible. There are definitely things where like you wouldn't be nervous the whole day or, I have to be on where we'd have an orientation in the morning for the interview day, and then you'd kind of relax for a few hours, then you'd go to your interview. And I remember like as soon as I was done, I would just be off my suit, back in my lazy clothes, back on my couch, watching TV. I can assure you that would not happen at all otherwise. Personally, I didn't find the Zoom interviews too bad. I actually really enjoyed them, and the socials weren't too bad either. I think it's something to just adjust to, and it wasn't too bad. But I think that's something you'll expect this year is that it'll be very, very similar. But, if you're just kind of used to it a bit now, it sounds like most people are with Zoom, then I think it'll really go really well. And the schools will be prepared for it as well. In regards to advice, I do agree with Carter as well. Like, I think residents are a great resource. I think for me, like some things that I tell both third year and fourth year medical students is just make sure you're doing the basics really well. And so what I mean by that is that, especially in ophthalmology, it's very, very tough to do a consult or doing the physical exam or slit lamp, and we don't really get much practice from it. So there really isn't much of an expectations from medical students early on, especially in their first few electives, to know how to do those skills. But I think basics is like, showing up on time. Like personally, I try to show up at least 15 to 20 minutes early, even before staff would show up, just so I'm present, or trying to read up on, what the day's looking like. Making sure that you're always ready to see a patient. And I think those similar things are there as a resident as well. I think just showing that initiative, making sure that you're not avoiding any learning opportunities, because they want to make sure that if you're doing that as a medical student, then you're going to do it as a resident, and then you're going to do it as a staff, because it's a lifelong learning, in medicine. And so I think doing just basic things over and over again really well, I think to me, that's what a good candidate's like. And of course, being very, very nice to everyone. I think we work in a team, and it's not just being nice to residents and physicians, but also like our other, allied team staff and MOAs and any and every hospital staff. Like it takes a whole team to run our healthcare system, and not just the doctors.
No, that's amazing advice from the both of you. I feel very lucky to be able to listen, and I'm sure our listeners do as well, like to get both opinions from PGY2, PGY3 who have gone through like two different completely CARMS applications. It's like very relevant. Like Emaan and I are in different medical years. I'll be applying when I have visiting electives. Emaan will not. And so it's amazing, especially to see the pros and the cons of the both. It's very helpful. Thank you guys. We're going to switch gears just a little bit outside of medicine. I think we spend a lot of time on this podcast just talking about ophthalmology and medicine. So I guess we want to hear a little bit about like what you guys do for fun, like how to maintain a work-life balance in residency, a little bit about like what residency is like outside of, being in the ophthalmology clinic or like being, fully present within the hospital. Mahadev, if it's okay, we can start with you.
Yeah, for sure. I think kind of I mentioned in my bio, I'm a very cliche Vancouverite or a BC person. I enjoy enjoying new cuisines, being up in the mountain with skiing and hiking whenever I get a chance. Try to go at least once or twice a year for activities. So definitely a West Coast thing. I think for me, it's what I've realized is you have to kind of schedule it. You have to make it a priority, similar to kind of what you make a priority for other things in your life, whether it be family or friends. So I think you have to be able to kind of do that. And obviously you have to adjust it to kind of the position you're in. So some rotations for me, I know will be tougher. Like, if I'm on day call at St. Paul's or at VGH, then I know that's going to be a tougher rotation versus a subspecialty clinic. when I know it won't be maybe sometimes as long of a day, and to kind of to use that. So for me, that's really important. And then in regards to kind of our resident group, I think we've really tried to at least once a month do a get together. Generally, it ends up being through staff as well as outside, and otherwise we kind of plan our own thing. I know recently Carter actually planned one for a new restaurant that opened up by his new place. So a few of us got together there and enjoyed a really fantastic meal there. And it was really, really great. And I think our one of our chief residents, who's part of the social aspect of the group, they're starting a recreational league for us to all participate in. So I think that'll be a great way to connect with each other.
Man, I'm so pumped for multisport. It's going to be so good. So there's this to elaborate, there's this, I guess, league called Urban Rec in Vancouver. So they do all these kind of different sports. And we signed up for this multi-sport league where literally every week you play a different sport.
Oh, that's awesome.
And so we do like basketball and soccer and volleyball, handball, dodgeball, and something else it's not coming to my mind right now. But I did it last season with some of my friends outside of medicine, and it was just a blast. So I think it's going to be a really good bonding time for the residents, and our partners are also playing, so I think it'll be really fun.
Do you guys have an ophthalmology related team name yet?
No, we still have to think about that. That's a good point. I had thought about not ophthalmology specific, but the Seattle Sea Docs was an option, and then the Pittsburgh Healers. Those are my ones on my right now.
It's actually great,
but I could also be fine with just like Liverpool multi-sport team.
Great. If any of our listeners can take something away today, it's that Carter is a big Liverpool fan.
Wait, what?
Yeah.
Is that not what he said?
Yeah, that's the big take home for the medical students. But continuing on that topic, outside of work, I do like to watch the Liverpool games. There's a supporters club down at the Butcher and Bullock, which is a pub down in Vancouver, and me and my partner frequent that as much as we can. But outside of medicine or outside of work, yeah, it's mostly sports, I think. And like I said, I do a little bit of photography, so I try to use that to find some work-life balance. But like Mahadev said, I think that as you go through residency, it gets more busy and more busy. And so being sort of organized and efficient with planning and specifically setting aside time to, make time for your outside of medicine life, I think is really important. Otherwise it can be a grueling marathon.
Well, thank you both. On that note, we've kind of wrapped up all of our ophthalmology-ish related questions. And as our listeners know, we now move into our Would You Rather segment. So you guys can pick who goes first, but I'll start with the first question. Would you rather never be able to go out during the day or never be able to go out at night?
I can go first. I would for sure rather never be able to go out during the night because I like the day so much. I think there's so much to do during the day, especially in Vancouver. Like one of the nice things about Vancouver is that you're so close to the ocean and so close to the mountains. And so there's so many activities that sort of involve outdoor activities that I think that if you were just living the nightlife, you would be missing out a lot. Also, our nightlife is not the greatest in Vancouver, so that's another reason.
Fair enough. Mahadev, I'm expecting a pretty similar answer, I feel like.
Yeah, unfortunately, I really don't have a nightlife either. And I've never been I'm pretty much a homebody in the evenings. So, and I love being out during the day. So I think that would be an easy one for me as well. Being out in the day would be definitely my top choice.
Nice.
Awesome.
I think I'm the same. You, Danielle?
Yeah, me too. Especially in the winter when it gets so dark so early and you feel like you've just missed the entire day. It's quite difficult.
And Kingston's got some fun stuff during the day, like the lake's super nice. That you guys got that farmer's market, right?
Exactly. It's right by my apartment, so it's lovely. Nice morning stroll. Yeah. Okay, now my question is, would you rather oversleep every day for a week or not get any sleep for 4 days in a row?
Maybe I'll go first with this one. I definitely would oversleep. I feel like I'm already oversleeping anyway. So every day of the week, I'd rather do it. I think my only thing would be just being late to places. So I try to be on time. But, I think lack of sleep would be much, much worse.
Yeah, for sure. You guys got to come up with some harder. Which would you rather? I think
we're running out.
Yeah, maybe I'm going to eat those words soon. But a 4-day all-nighter. I feel like maybe we both come pretty close to that on call sometimes, but it's maybe not that close, but feels close. Yeah, I'm definitely like my sleep. I don't know how some people go, sleeping 4 hours a night routinely. I think that I definitely like my 7 to 8 hours. So I would definitely pick oversleeping for sure.
Yeah, I think we picked some pretty easy questions today, but we'll try.
That's actually probably good.
For the next episode, we'll do better. Well, on that note, I just wanted to say thank you so much again to both of you for joining us today. And thank you to our listeners for listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. To stay caught up with everything else that iCurriculum is doing, be sure to check out our website at www.icurriculum.com and follow us on social media at iCurriculum. Thank you guys both so much again for being a part of our podcast.
Yeah, thank you so much for having us. I know as a fan, I really appreciate it, and I had a lot of fun doing this with Carter.
Yeah, thank you so much for hosting, and thank you, Mahadev, for including me in this fun little get together.
Thanks, guys. Bye.
Bye now.
Yeah.